Mr. Speaker, an average of 7 Manitobans have a stroke each day in this province, and yet this government continues to drag its heels. 19 years ago, tissue plasminogen activator, or TPA, was shown to be an effective treatment for stroke. But this NDP government has failed in over 14 years to introduce effective, coordinated, province-wide treatment all over Manitoba. Today, Manitoba is the only province without a dedicated stroke unit to ensure high-quality care for patients in the critical hours after the initial treatment with TPA.
That's right.
Why is Manitoba's NDP government such a laggard when it comes to introducing proven, cost-effective approaches to improve the health of Manitobans?
Yes, thank you very much, Mr. Speaker, and I thank the member for the question. Certainly we know from our medical professionals that the moments after a stroke are critical in terms of the kinds of treatment that is administered. And timely stroke care, as the member has rightly pointed out, including drugs like TPA, can be the difference in the stroke victim's quality of life. I would let the member know, in fact, that when it does come to rapid access to this life-saving drug, Winnipeg has recently, by the Canadian Stroke Network, been recognized as having the best door-to-needle time in the country. That is to say, HSC had a time of 15 minutes compared to the national average of 74 minutes, Mr. Speaker.
Mr. Speaker, but the dedicated stroke unit is needed to ensure excellent care after the needle is put in.
Exactly.
Mr. Speaker, in a recent CIHI survey, 10.9% of stroke patients in Manitoba died in hospital within 30 days of being admitted, compared to a lower death rate in the rest of Canada and much lower death rates in many other countries. Under this NDP government, we've had 14 years of wasted time as they failed to prioritize stroke care. Manitobans cannot conveniently put their ischemic events on hold while this NDP government puts its priorities elsewhere, as the health minister said last night. I ask this government, where is the long overdue and desperately needed coordinated, dedicated unit to provide optimum stroke care?
Yes, thank you very much, Mr. Speaker. And I can inform the member, he seems to have neglected this in his analysis today, that in 2011 we did in fact launch the Manitoba Stroke Strategy, which is working to prevent disability, improve quality of life, Mr. Speaker. We are also seeing that our focus on prevention and healthy living has seen a decrease in the number of Manitobans who suffer with a stroke. Over the past decade, we've seen a 25% decrease in the amount of Manitobans who suffer a stroke. Mr. Speaker, within the context of that stroke strategy, certainly we recognize that there is more to do, but by creating the Integrated Stroke Project and other initiatives, we're seeing tangible results, and we're going to continue to work to get even more, Mr. Speaker.
Mr. Speaker, excellent treatment for stroke has been shown to save lives and also to save dollars, be cost effective. And yet it's not available all over Manitoba.
Shame on
Mr. Speaker, a Manitoban having a stroke is an emergency in which time is of the essence. Why is it that after 19 years, after TPA was proved effective, that adequate contemporary care is not available in Thompson and for people in northern Manitoba?
Exactly.
It's vital to have care in the north in the light of flight times to southern Manitoba. When will the government ensure the ability for citizens in northern Manitoba to get adequate stroke care in northern Manitoba?
Yes, thank you very much, Mr. Speaker. And again, I thank the member for the question. We certainly acknowledge that through a variety of efforts, we have seen a 25% decrease in the incidences of stroke. We have seen Winnipeg be recognized as being a centre that has the best in the nation a response time, door-to-needle response time for TPA. We know in the context of developing the stroke strategy and working with our families with lived experience as well as our doctors that there's more work to do. We know that stroke centres in other jurisdictions have had some success. We're very willing to look at those and develop them, but the comprehensive strategy is showing tangible results, and we're going to keep working on that, Mr. Speaker.